Now. Awesome. Just a reminder that if you are not speaking, to please keep your microphone on mute so that we can hear the folks who are talking. We will be pausing periodically for questions, but if you have a question and you don't want to lose it, you can always feel free to enter it into the chat. And we'll have someone either respond to it if they know the answer, or we can ask it during the Q&A period. And with that, I'm going to hand it over to the wonderful Gabby to do our language announcement.
Good morning, everybody. This is Gabriela, and I'm the Spanish interpreter today. And I would like to show those who prefer Spanish how to join the channel. If you're using a computer, please go to the bottom of your screen and you will see a globe. Oh, I'm so sorry. Why am I going in English? Spanish, Gabriela. Hola, buenos días, ¿cómo están? Esta es Gabriela, soy la intérprete de español el día de hoy. Si les gustaría escuchar en español, por favor, vayan a la parte de abajo, va a haber un globo terráqueo que está allí, que dice interpretación, dele clic, seleccione Spanish o español. Y si usted es como yo, que somos visuales, por favor vaya al chat y allí va a ver las instrucciones también. Si está usando un teléfono o una iPad o tableta, por favor toque su pantalla. Va a haber una lista de iconos en la parte de abajo. Muévalos a la izquierda. Va a haber 3 punticos. Al final, escoge esos 3. Va a haber interpretación, Spanish o español. Y por último, finalizar o la palabra done, D-O-N-E. Una vez que seleccione ello, se va a dar cuenta que la palabra Spanish aparece en la pantalla, en la parte izquierda. Si necesita ayuda, por favor, no se cohíba de pedirnos ayuda. Estamos aquí para ayudarle y voy a colocar las instrucciones otra vez en el chat. Thank you, everyone. I just posted the instructions again in case someone would like to read. I'm very visual, so this is for the visuals. Thank you, everyone.
Thanks, Gabby. I'll hand it off to Angela.
Thanks, Gabby. Thanks, Bree. Hi, everybody. Welcome. Thank you for being here today. My name is Angela Farwig, and I am the Vice President of Public Policy Advocacy and Research here at Illinois Action for Children. I'm so excited to be here with you all today. So we are going to do some introductions. To welcome all of you, we would invite you to type your name and organization into the chat. And also, if you want to, share a response to our icebreaker question, which is, what's your Halloween costume? Very seasonal, very timely. Doesn't have to be you, could be a child, a niece, a nephew, a pet, anything you want to share, we would welcome that. I will share my Halloween costume, and then we'll go through some introductions. So as some of you know, I'm a little bit of a Swiftie, a Taylor Swift fan, so I'll be dressing up to honor her Eras tour in the Red era, which is one of her albums. So I will be wearing a look that looks like that album. So I'm very excited. Okay, so put that stuff in the chat, and then we'll start introducing ourselves. We're just going to go through. We have a bunch of people from the amazing PPRA team here with us today. So Aman, why don't you kick us off?
Hi, everyone. I'm Aman. I'm the new Public Policy Research and Advocacy Project Manager for the PPRA team. This is my first fall into action, so I'm really excited to be here, and it's really nice to meet all of you.
Hi, everyone. I'm Alejandra Flores. I'm a Research and Evaluation Analyst, and I'll be dressing up as a fortune teller.
Hi, everyone. My name is Arunima, and I am a Senior Research Associate with the research team here, and I will be dressing up as Ponyo, which is a Studio Ghibli character.
Hi, I'm Bree Stormer. I'm the Senior Policy and Engagement Specialist. I don't know if it's going to happen this year, but maybe next year, hoping to dress up with my husband as the Moonrise Kingdom kids for the Wes Anderson fans.
Hi, I'm Naoma Nagawata. I'm the Assistant Advocacy Director at Illinois Action for Children, working primarily on We the Village, and I'm trying to convince my son to go as Mudang, and I will be the zookeeper. Passing it on to Michael.
Hey, good morning, everyone. My name is Michael Kim. I'm the Director of Public Policy at Illinois Action for Children. Uh, I have not dressed up for anything for Halloween in the past 25 or so years. So if anyone has an idea, let me know, but currently nothing for me. Rachel.
Hi, all. My name is Rachel Gray. I work with our Health and Safety Resources team supporting license exempt providers, and then on the Public Policy Research and Advocacy team as an MSW intern. I have no plans for Halloween and will not be dressing up, but if I were, I would be a hobbit from the Shire.
I think that's everyone. Thank you so much, team members. And I was so eager to share my Halloween costume that I forgot to just mention why we're all here today, which is to attend our regular Fall into Action webinar, where we really want to both share information and educate all of you about what is happening right now in our state and the policy landscape, as well as some of the policy priorities we at Illinois Action for Children will be looking to advance in the upcoming legislative session and in 2025. So we definitely want to share and then also hear from you. So definitely put those questions in the chat. And we also have an opportunity at the end of the webinar to go into some breakout rooms, and we'll have some questions and we can share, get some feedback from you all during that as well. So definitely wanting this to be educational and helpful to you all, also educational and helpful to us to hear from you. And really, again, thank you for being here today. I think I'll kick it over to Michael to go through the agenda.
You just went through the agenda, right, Angela? Right?
No, I just shared about sort of why we're all here today and
Okay,
some of the goals of
perfect.
Fall into Action. So you're up for the agenda.
All right, sounds good. Again, welcome everyone. So this is the agenda that we're gonna go through today. We're gonna do some federal election, I guess PSA, federal and state update. We have a great presentation from Aruna on our third Illinois Parent Survey panel research that we've been doing. After that, we'll take a quick break, and then Ann Whalen, the transition director for the Department of Early Childhood, will be joining us to do some updates on early childhood, the Department of Early Childhood, and some of the transition work that is currently happening. And then, like Angela mentioned, we're going to go into some breakout rooms and then share out, and then hopefully get you guys out of here on time. So if you guys are ready for the best hour and 20 minutes of your Thursday, we can get this started. All right, so as you guys all know, it's election year. November 5th is election day, and to help you all prepare, we want to provide you guys all with some links that can show you, A, if you're registered, and 2, if you're not registered, there's some different ways that in which you can do it, and we wanted to provide that link to you so that you guys are all prepared, ready, and able to vote if you would like to on November 5th. With that said, we know that election year is usually a lot where we want to talk about a lot of issues and a lot of policies. And for most of you guys who are in this field, I think for as long as I can remember, early childhood has never been like the big issue, big topic policy that many candidates talked about. But I think the tides have changed, and we're actually in that area where early childhood has become topics in debates, topics in town halls, topics in candidates all at the state and federal level. So I just want to show you guys a little bit of the data in which it is helpful to know how this resonates with people who are voting and with candidates as well. So if we go to the next slide. Oh, sorry, yeah. There we go. Again, as you guys all know, when voting, you should do your research and on each candidate that's on the ballot. For Illinois, this year we have all 118 state house seats will be up for re-elections, and 23 out of the 59 state Senate seats will be up for re-election. In addition, all 16 U.S. House Representative seats will be up for re-election, but neither of the two U.S. Senate seats will be up for election until next cycle. This is a new poll conducted on behalf of the First 5-Year Fund, which is a national nonprofit that does early childhood policy. And through a bipartisan research team, they found that in this election year, voters by overwhelming margins want candidates to have a plan to address childcare challenges in the United States. A new poll, as you can see, 89% of all voters want a candidate to have a plan that would address helping families and afford quality childcare. Childcare policy is one of the top issues around candidates, and this is definitely something that is resonating and talking about for across all boards. Next slide. Yep. Oh, sorry, one more. Sorry, can we go back? Sorry. Voters make a strong connection between childcare and strong economy. I think a lot of us have been trying to put that connection together. With about 68% of all voters saying access to high quality, affordable childcare is essential and is very important to strengthening our economy. This includes 53% of Republicans, 64% of independents, and 84% of Democrats. In addition, childcare also cuts across other societal concerns, such as public safety and national security. So basis of these two slides is that the numbers don't lie. We know that childcare is essential to how the country moves. So we need to make sure that the candidates that are on the ballot know that issue as well, and that they have some sort of ways to fund early childhood education, ways to expand early childhood education, and to really be able to support in policies that help early childhood educations. With that, I am going to transition us into some federal and state updates that would be timely as we are going through some interesting parts of our country at the moment. So as you guys know, back in September, Congress passed a stopgap bill to avoid a government shutdown, which the stopgap bill will continue to run the government until November after the elections. When Congress comes back after the elections, they will have to either pass a full year budget for FY25 or pass another continuing resolution, or what we call CR, to keep the government funded. As we're thinking about this, there are two current bills that are actually on both sides of the chamber at the federal level, one on the Senate side and one on the House side. The Senate FY25 Labor, Health, and Human Services, or known as Labor HHS Appropriations Bill, would increase childcare and early funding by $2.3 billion from FY24 level. So an additional $2.3 billion added onto childcare funding for FY25. Majority of this would go to the Childcare Development Block Grant, or CCDBG, as we like to call it, or CCDF for some that go with that acronym. So $1.6 billion, or 18% increase of the, there will be a 1.6 or 18% increase in additional funding from FY24. That goes to CCDBG, and then for Head Start, we would have an additional $700 million increase over fiscal year 25, which will help support Head Start teachers and staff as local programs face ongoing staffing challenges. The increase in funding for both, as you guys all would know, that it will help more families across the country access and afford childcare that they desperately need. In contrast, the House Labor, Health, and Human Services and Education, which is a little bit more of a mouthful, appropriation bill, will cut childcare program funding by $3.7 billion from its FY24 level. This means that there will be very moderate increase to the CCDBG and Head Start programs for the House Appropriation Labor HHS bill. It will only be a $25 million increase from the FY24 level for both CCDBG and Head Start. If you guys are inclined, and if you guys have time, I'd recommend that you guys call your state, U.S. congressional representation and ask them to support the Senate version of the appropriation bill, because obviously the Senate version gives the money that we need to make sure that we have enough federal funding to support our programs. All right. We talked about the federal issues and federal priority or federal budget issues that are currently happening. Now we're going to move on to some of the state level budget talks that we're going to prioritize for FY26 or spring session 2025. So as many of you guys know, each year, Illinois Action for Children, along with our partners, make a big push and increase for funding for early education and care programs across Illinois. This year is no different. The following are some of the numbers and increases that we're advocating for in Springfield for our spring 2025 session. As you can see, there's two separate line items here. there was one line item in the first year of the implementation of the Smart Start or Smart Start initiative back in year 2024. And this year, year 2023, and this year in year 2024, they actually split the two line items into the Child Care Service line item, which has the CCAP program in there, the Child Care Assistance Program, and other aspects of child care programs. And then they created a Smart Start Child Care line item, which encompasses the Smart Start Workforce, apprenticeship programs, the quality support grants, and some other aspects of it as well. So this year, there's two different line items. So I'll go over our ask for our childcare service line item and then do the Smart Start Childcare. So with data that we've gotten from DHS, we've seen a steady increase in caseloads for CCAP, where we're back to pre-pandemic levels, and it continues to rise. In addition to caseloads, as many of you guys know, there is a new contract between the state and SEIU that would raise CCAP reimbursement rates for home-based providers. Unfortunately, this contract didn't include a rate parity for center-based programs, which they usually do in previous years. And I will talk about how we are hoping to address that in our $55 million budget increase ask. So within the $55 million addition to FY25, we'll be asked within this $55 million, we'll be asking that they continue to focus on the caseloads that are currently rising. We projected that a 11% increase from FY25 to FY26 is what the rate at which we're going at right now. So we're hoping that the $55 million will cover that increase, as well as the 6% increase that is currently in the contract for home-based providers. With our $55 million ask, we also included a 3% increase for center-based program so that they can at least stay within the rate parity of home-based providers and make sure that they also get an increase and not only home-based providers. Lastly, in this $55 million, we accounted for an increase in amounts of quality support add-ons that usually happens with the Accelerate Accelerate Circle that you get when you participate in that area. So as increases for caseload goes up, we need to account for the increases in quality support add-ons as well. Second part, for Smart Start Childcare line item, we were asking for a $150 million increase. According to IDHS, for FY26, there needs to be at least a minimum of $200 million to continue to support the grants as they are at their current rate. Out of the $150 million, we're asking that $110 million of that goes into the Smart Start Workforce grants, which will be a total of $220 million for FY26. It's a little bit more than what DHS is asking for or thinking that we need for a minimum, but we think that the extra money is definitely needed to keep up with pace and to be able to expand the grant as well. Of that 115, $5 million will go to the early childhood apprenticeship program, which is something that UIC is a big part of. That's what they're doing over at UIC, and we're just hoping to continue to add on to that program to keep the workforce growing and expanding. And lastly, before I pass this off to Angela, $75 million will be going into the early childhood block grant. If you guys remember when the governor introduced his Smart Start initiative, he had a budget summary for 4 years where he wanted to put in additional $75 million every year until FY27 to help increase new pre-K slots and to help address some of the what some people call childcare deserts. So $75 million increase will go into this FY26. We got numbers from FY24 in terms of slot creation. As you can all see, there was more than 5,000 slots that were created, which is was over the projection that over the goal that the governor wanted to strive for. And then we had an additional 500 for preschool for all expansion. In addition, we had prevention initiative, 428 home visiting, and 702 center-based PI visits. So that's definitely going up as well, which is something good, something we like to see as well. And again, the last thing that the Early Childhood Block Grant, the $75 million increase will go to is increased funding to expand. To make sure that the funding will provide additional COLA and different areas of increased payments for educators as well. I said a lot, so I'm going to stop and let Angela finish off some of the budget asks that we will be doing.
Hi, everyone. Okay, 1 second. I am responding to something in the chat. Okay, and now I am ready. Thank you for your patience. Okay, so I'm up to talk about just a few other line items in our sort of core early childhood program lines. So right now we are planning to advocate for a $60 million increase to the early intervention program in our state. I think many folks on this call know that this program, which provides supports to infants and toddlers who have or are at risk of developmental delays or disabilities, so a super critical program. There's been a lot of service delays in that program, directly tied to the need to invest more in the workforce that provides essential early intervention services. So this increase would allow DHS to then sort of provide a significant pay increase to folks that provide these services within that program. So we are definitely working in partnership with our friends and advocates over at Start Early and the Raising Illinois Coalition to advocate for this increase. Go to the next slide. So another line item that we always want to advocate for is home visiting in the DHS budget. And so here we're looking at a $5 million increase to advocate for in the FY26 budget. Again, we're always trying to invest in our essential early childhood workforce, which includes home visitors with this increase. And then also thinking about a lot of the really important infrastructure that we have in our state. Illinois is definitely a leader in home visiting. And so we are building out that infrastructure to ensure we have really strong professional development, data, capacity building, et cetera. So we'll definitely be advocating for that as well, again, in partnership with our advocate organizations. And then I think I have one more ask, and I think some of this is coming up in the chat as well. So as many folks hopefully do know, the state a few years ago set up the Early Childhood Access Consortium for Equity. And that was a really fantastic set of supports for the incumbent early childhood workforce to support them in going back to school to be able to get increased degrees and credentials so that they could really grow in their skill and expertise in the early childhood field. And that program, including robust scholarships that were made available to members of the workforce, was funded through federal COVID relief dollars. And so as those funds have been spent down and eventually have gone away, it was really important for the state to invest money to keep this scholarship program going. And so you may recall that last year, many of us and many of you on this call advocated for state investment in the ECA scholarship to really try to ensure that folks that have that scholarship could continue in their programs and get those degrees and credentials. So we didn't get the amount that we asked for last year, but we did get $5 million and a line item in the budget, which is a really important win because this is now a program that we can continue to advocate for this year. So this year, we are looking, right now that program is currently funded at $5 million. We'd really like to see it get up to the $15 or $17 million range. And so our ask is for a $12 to $15 million increase in that scholarship program. And on this slide, we've actually shared some data that we have both from the Illinois Student Assistance Commission that administers the scholarship, as well as a survey that a few advocates and the coalition members did fielded to recipients of the ECA scholarship. So just to share a little bit of that data with you. This year, for this current academic year that we're in, there were over 3,000 applications for the ECA scholarship. And due to the limited funding that was available, only about 660 applicants are receiving scholarships. And I did that quick math, and it's somewhere between 20 and 25%. So we know that there is a huge demand for the scholarship. We know that the need is there. Again, some of the advocate survey highlights show that as well. Many folks that are using this scholarship are working, and so they are going to school part-time. So they are taking, coursework class by class. So many of them have not yet completed their program. and a fair amount of those will likely leave the field if they are not able to complete their program. And 98%, that's a huge number of respondents would like to reapply for this scholarship. So this is just a really essential workforce support that we'll be advocating for again this year. Oh, and this is me too. Sorry. Okay, I lied. I have one more slide. So I know there's a couple questions, so we'll get to those in just a minute. We did want to highlight a couple other sort of policy priorities for the upcoming legislative session. So as folks know, there is a new Department of Early Childhood, and there was legislation passed last session to establish that, and we worked really hard, as did many people on this call, to advocate for that. And so we will be watching to see if there's any other legislation that is related to the new Department of Early Childhood that is filed or needs to be filed, and always looking to the voices of families and providers to sort of show us the way on that. The other budget or the other policy priority I want to mention are early childhood construction grants. Folks may recall that a few years ago, there was money appropriated to support early childhood facilities. There was a process you could apply for this funding. And some of that money was distributed, but we know there's about, I think, $40 million right now that we believe is still part of that program. There was some restrictions on that funding that were passed by the legislature that really directed it to school districts. That limitation is removed now, it expired. So this year we will be thinking through advocacy strategies to try to get that money distributed. That might be administrative advocacy, might come in the form of some legislative advocacy, maybe a resolution. We'll be looking to our partners at Civic Leaders for Illinois Children to support that work as well. All right, I think I kick it back to Michael.
Yeah, so we have two really quick slides, and then we'll just finish off and then go into questions like Angela said. So finishing off on some of the policy priorities, we have two additional policy priorities that we'll be focusing on. Paid family medical leave, which is to put into law family medical leave that will allow 26 weeks of job protected leave per year. This is a initiative that the Time to Care Coalition, backed by the Women's Employed Organization, is doing. Many of us advocates are on this coalition, and we'll be working with them to help get them help them get this bill passed this year if possible. Last year, they introduced two bills, which didn't go too far because mainly it was political in terms of a lot of legislators didn't want to vote for something that had tax implications because it was election year. We were hoping to get better and convince them that this is something that is needed in the state, and we will definitely be working on that. Secondly, there is a child care licensing omnibus bill that Illinois Action for Children and Start Early will be working together to help push forward this year. As Angela mentioned, as the new department is getting set up and things will be changing, we wanted to kind of address some of the current issues that are happening with licensing delays and abilities for providers to be able to get teachers hired quicker, hopefully get more information through web portals and online, make enrollment simplify enrollment for documentation issues, and hopefully to get more data and transparency from DCFS to providers. So we'll be working on this. More details to come on this as we continue to continue to work on how to draft this and to kind of incorporate this into our coming session. Lastly, quick update on what we will be doing for veto session. Many of you guys know veto is in 2 weeks after the elections. We will be working on two separate bills that we were working on in the spring of 2024. First one is HB 814. This is a data collection bill that Illinois Action with Children is working with Representative Syed and Senator Johnson. This was a iteration of our original bill, which was to create a CCAP expansion for early childhood educators to be enrolled into CCAP as long as they are working in the field. A lot of the issues one of the main issues with that was that we didn't have a great cost estimate on how much this would actually cost to expand CCAP to early childhood educators. So a lot of pushback from legislators saying, you know, we don't know what the cost is. You guys need to get a better cost estimate. So we wanted to make sure to reply to that and get a true cost estimate. So this salary and staffing survey that DHS does every 2 years, we're hoping to incorporate more input from the community partners, educators, and providers like all you guys, and to help really get some of the data that we need to get a true cost estimate that will reflect the change that it would need to expand CCAP. Second is HB 4412. This is another licensing bill that Representative Villa introduced in spring 2024. This basically allows early childhood educators or providers to get fingerprinting done at a third-party vendor instead of going straight to DCFS. Hopefully this will cut down some of the delays and some of the issues that we currently see. I will stop there and stop for questions.
So I know there were some in the chat that I want to make sure we get to, and then I see a hand or two raised. So I'm going to look to my team members to make sure we cover all these. I know Jill had a question on the Smart Start quality support grants, and it's a really excellent question. So folks may know that the Department of Human Services has been meeting and convening folks to develop the Smart Start Quality Support Program, which is a continuation and really based on the Accelerate pilot. I know Jill and other folks have participated in that pilot. It's been really, really essential. So that program is funded at $10 million. Right now, our budget ask is keeping that level funded based on some information we received a few years ago about the Governor's Smart Start plan when that was sort of mapped out for us, as well as the fact that we're still developing this program and we don't know what the parameters are. So as of now, that is sort of what we are thinking. This is, I would say, we will also look to the department and to the governor's office to set a course for this program and to see if there are any adjustments we want to make. But right now, just because that program is still sort of in development, right now our ask is for it to be continue being funded at the level it's at, knowing that it might be subject to change once we know more. So I know that's not a wholly satisfying answer, but that is our thinking right now. And again, if folks have feedback on that, please let us know. And then I think there were questions about eligibility for the ECA scholarship for master's degrees or post-bac degrees. And Michael, I think you can take that.
Yeah, so before it was for both undergrad, bachelor's, associates, and post-bachelor's. But obviously because of the $5 million funding that we're only able to get for FY25, unfortunately it's only for bachelor's and associates, and it is basically prioritizing those who were previous recipients as well. So they have limited the number of folks that they can give money to and what the money could be used for in terms of different levels of degree. So hopefully we can get more funding for it in FY26 so that we can kind of expand it.
There were a couple of other questions. When you say home visiting, what programs does that include? Prevention initiative? And it was my understanding that the SSQS program would be expanded. I don't see any recommendation for funds to accomplish this. I think we've actually just done that.
We answered
And
that
then the
one.
last one is, can you elaborate on the paid family and medical leave for up to 26 weeks?
I can take the quality grants and the pay family leave. So quality.
No, Michael,
or do you wanna
the
do-
question was about Smart Start support, quality support grants, which
Yeah.
I covered.
You did, okay, all right.
Yeah,
sounds good.
so I think, sorry, the chat is really hopping, you guys. Thank you so much. I think there was a question about home visiting funding, which I believe we got some folks that are attending. David in the chat answered that question.
Excellent.
If I can find that answer, I will say it out loud so everybody sees it. So yes, the $5 million home visiting increase is for DHS funded home visiting programs. Home visiting programs run through the Prevention Initiative at the State Board of Education are included in the $75 million request for the Early Childhood Block Grant. And then paid family and medical leave, Michael, I think would go to you.
Yeah, I apologize because that is actually going to take a while. I know we're a little bit behind in time. So whoever asked that question, if you want to just email me, and I can definitely send you information with that. But honestly, like I was trying to think about how to say it very condensed way of saying it, but I just can't unless I forget to say a bunch of stuff. So if you don't mind putting, or actually, I'll just put my email and then you can just email me. Yeah, there we go. Thanks, Naomi.
There's a couple of hands raised as well. Do we want to go to those? Azar, would you like to ask a question? And then Barbara? And then maybe we can answer in the chat some of the other questions so we can move on. Azar, you're on mute. Okay, I think you're still on mute. You want to try one more time? Okay. Azar, we can't hear you. Maybe you could put your question in the chat. Let's kick it to Barbara for a minute. Barbara, would you like to come off mute? And Azar, we can come back to you, or you can put your question in the chat.
I saw briefly where you mentioned the increase for the add-on. Is there a percentage of increase for the add-on, or is it something that's actually in the works, or something that's a part of that 55 million increase?
So you're talking about specific add-ons to your reimbursement rate, or are you talking about our?
For the quality add-on.
Yeah. So I believe with the Accelerate, it depends on which level you're at. I think if silver is 10%, and I think for gold level is 15% add-on to your reimbursement rate. So for us, we just calculated the increase of that into our budget because as caseloads goes up, we have to account for some of the rate in which the add-on rate goes on. So that the percentage of total, ours is just a total percentage. It's not a specific percentage of how much providers will get. That is within the Accelerate system or Accelerate program.
So if you are on the gold or silver and you're getting 10% or 15%, do the increase go up, or it's just to keep the?
Yeah, we're just keeping with the pace of it. So your rate will just be paced with what you're currently getting within your current reimbursement rate. So we're not saying the reimbursement rate and your additional money is going to go up. We're just asking for additional money to cover whatever the rate is gonna keep up with. Yeah. So
okay.
Yeah.
All right. Thank you.
Mm-hmm.
Now I can talk.
Okay, go ahead, Azar, and then we'll try to answer the other questions in the chat.
Okay. First of all, thank you for the opportunity. I just don't want to talk negative, but you know, when we started with the village, and then especially during the transition to the Department of Early Childhood, there was a new excitement for all of the daycares that I have connected with around us, you know. And now that excitement has transferred to much anxiety because there is lack of communication, there is lack of transparency, and also we see that, you know, we appreciate the help and the grant. Without that, we couldn't survive, of course. But we think that it is more like a Band-Aid, but it doesn't cure what our challenges are. And from the beginning of We the Village, we were talking about that as long as there is no equality between the teachers who serve, you know, with their heart, the community, that all these centers are located with the ISB teachers, they're not going to any problem to be solved. We, as of a community daycare center, we lost another teacher, very qualified teacher, due that ISB, you know, public school hired her right away because she's qualified. And when I talked to her, honestly, she says she loves this place. She doesn't want to go to public school because the relationship is very close, very comfortable. She said the only thing, she's young and she needs retirement. You know, she needs insurance, she needs security. Another teacher that has a master's degree, you know, I'm very qualified. I don't know how long she stays with us. She was giving me this example that when, you know, I talk about, you know, equality with ISB, they say, yes, we know, you know, but at the same time, you should know that you're working with the children is very gratifying, but it doesn't answer my need of everyday life. You know, it is gratifying, but it doesn't. What I am saying that, yes, we through the, you know, and we appreciate the help, you know, but it's only a Band-Aid. Is not going to solve the problem as long as there is no equality. And the department, you know, I had a lot of hope and I don't have it anymore. And this is what we are going to have another meeting with other directors that not only we received this grant in such a hard way that, you know, they put so much condition. For example, I have to increase I have to increase all the teacher, which is not a problem for me. I was really pushing, you know that. I was pushing for that. But at the same time, we are a class that licensed for 10 children. This license has given by DCFS to us. And they are not giving us the grant money because we have 710, but at the same time, I have to increase the teachers, you know, salary.
Yeah.
So it's a lot of problem, complication.
Yeah.
And nobody is hearing us, you know.
Yeah.
And
so Azar, I just want to know, Ann Whalen from the transition team is going to be presenting in just a few minutes, and I would love for that to be part of that conversation. If there's a minute, I just want to let you know that.
I understand. I
yes,
appreciate the opportunity.
Yes,
Thank you.
Okay, thank you so much. And I think you raised so many important issues.
Thank you.
And thank you for being a part of our We the Village coalition. This is all things that we're working on in that coalition, and there'll be more information about that shared later. But yes, I think all in all, we all know we really need to continue to invest in this system so that all of our teachers and educators are paid a thriving wage, that they have access to benefits. And so we are really working tirelessly on that through all different kinds of strategies. And we know there's a lot more work to do. So thank you so much, Azar, for calling that out. We really appreciate it. And I think this will come up again later in our presentation. So I just wanted to name that. Okay, I'm gonna stop talking. I know there's some more questions in the chat. We'll get to those, and I will kick it over to the next part of our presentation.
Well, I can go on. Yeah. Hello, everyone. My name is Arunima, and today I would like to talk a little bit about the Illinois Parent Survey panel that we have. Could we move on to the next slide, please? Yeah. Thank you. So the Illinois Parent Survey panel consists of parents with children under the age of 6, and we have a series of quarterly surveys that we give to these panel of parents, where we try to gather essential and ongoing information about their joys, challenges, and overall experiences of raising children in Illinois. We tried to recruit from 7 Metro Chicago counties. However, we were able to talk to parents from 34 different counties in Illinois, and parents span a large range of household incomes, with most of them earning less than $90,000 per annum. And parents are also quite diverse in their race in our parent survey panel as well. So far, we've done 4 surveys. The first one was fielded in the fall of last year, and the second one in the winter of last year, and the third one spring of this year. And those 2 are uploaded on our website if someone wants to check them out and if they're curious about it. And I would like to talk a little bit about the experiences parents had with childcare in particular. Could we move on to the next slide? Thank you. So, so far, we have 455 parents that have taken our first, second, and third survey. Out of those, almost 3/4 of those parents use some form of non-parental childcare for their children under the age of 6. In our third survey, we asked parents who were using childcare if they found their arrangement to be reliable, and 89% of parents reported that their childcare was reliable to them, which is represented by the gold bar in this pie chart. And 5% of parents shared that their childcare arrangement was unreliable. Next slide, please. So we wanted to learn a little bit more about their experiences about their childcare arrangement, and we asked them what do they like best about their current childcare. We had a wide diversity of responses from parents. However, I wanted to share the 3 most common answers that parents had. Well, parents, they really cared about their providers being trustworthy, and they wanted their providers to be someone that they would feel safe having their children around. So they wanted them to have a bond with their children and treat them with care and patience. A parent shared that what they like best about their childcare provider is that there's someone that they can trust to take care of their child, and someone shared that it was their trusted family member. They also care deeply about the quality of care and education that their child received, which we have seen throughout our surveys, that they have a lot of high hopes about their children's overall growth and development, be it cognitive, motor-based, social, or economic growth. So a parent shared that
Who's out in the kitchen?
about their childcare was that their teacher does a good job of teaching educational concepts, and they also teach them songs and movement and ASL. And lastly, something that parents deeply cared about was that they had easy physical access to their childcare provider. It has been immensely important for parents to be able to find a childcare provider that they can easily travel to in the midst of their busy work schedules and their household chores. And in our 4th survey, we covered the topic of parents' experiences with transportation. So if you're more interested in that topic, please keep an eye out for our 4th survey. Next slide, please. We also wanted to talk to parents about what improvements they want in their current childcare arrangement. And similar to the themes in the last slide, location and having a flexible care hours is really important to parents. And when they do not have access to them, they really feel its lack as well. Time is such an important commodity to all of us, but especially with parents balancing such multiple responsibilities at work and household. It is really important for them to be able to have a reliable childcare arrangement that they can easily access and use whenever they need. So the parents shared that availability and closeness is something that they want to improve in their childcare arrangement, and another shared that they would like for some sort of flexibility that they can have. Parents also cited that they needed more affordable care option, as well as improved facilities and more amenities as well. One parent shared that providing breakfast and lunch for their children when they do not have time to probably prepare meals for their children would be a great improvement for them. Next slide, please. We wanted to learn a little bit about parents' experiences in looking for new childcare arrangements as well. So in our 2nd survey, we asked parents if they had been looking for a new childcare arrangement for their children under the age of 6. And out of those that did look for them, almost 3/4 of them had some sort of difficulty finding space in a childcare arrangement. And out of those that experienced difficulties, 92% shared that impacted their ability to work. We asked them an open-ended question as well on what were their top challenges to accessing childcare and finding space in programs. And parents shared that something similar to what we saw, that they really want a childcare that supports their work schedules, and that probably care that is during non-traditional as well as care that is affordable, were hard to find for them. So that were their biggest challenges. Next slide, please. And this is the last qualitative question to explore, which was we wanted to learn a little bit about their challenges as working parents. So we asked those that were currently employed, or if they had been employed in the past, what were their biggest challenges? And we received resounding answers from them. Firstly, parents deeply value spending time with their children, and they have such a wide diversity of ways in which they spend quality time with them. And they also experience so many challenges to spending that quality time, with their biggest challenge being work responsibilities and difficulties. Some parents have also shared that along with difficulty finding time, they also experience mental exhaustion and stress after work that makes it difficult for them. A parent shared that giving my son my attention and energy and being present with him what has been a challenge, and work took all my best hours and left me stressed and exhausted. Another parent shared that not being able to see certain things that my child does as he grows up is a big challenge for them. And a similar theme to what we have discussed before, parents are looking for childcare that fits their schedules. And in addition to the time constraints parents face, they're also managing multiple different responsibilities in the workspace, at home, as well as caring for their children and themselves. And this quote was really moving for me when a parent shared that there's just not enough time in a day for me to work, take and pick up my kid to or from school, take them to extracurricular activities, make home-cooked meals, clean, help kids with homework, family time, grooming, etc. And there were so many different quotes that were talking about all the different kinds of responsibilities that go into their day-to-day lives, which has been the biggest challenge for them. Next slide, please. Yeah. So we didn't just want to talk about their challenges. We also want to talk about the kind of lives that they live, the kind of support system that they receive as well, and the joys of caring for each other. So we asked them if they had friends, families, or a network of people that they call on for different forms of support. And almost 90% of parents on our panel have turned to someone for emotional support as well as parenting advice. And approximately 73% have reached out to someone for financial support and 66% for backup or emergency childcare support. Furthermore, parents also provide support to others, and most commonly, parents shared that they offer a lot of emotional support and companionship to others, as well as supporting them with their daily chores and day-to-day tasks. So they're not just receivers, but they're also givers of care and affection and support in their community. Next slide, please. And their community involves their childcare providers as well, because they help them beyond taking care of their child. A lot of parents shared that the providers help them in the form of finding resources for their child's development, applying for benefits, flagging developmental concerns, connecting to other parents, connecting to healthcare, as well as help in finding employment. So that's just a little bit that I wanted to share about the parent survey panel. If you're curious about who makes up our panel, their financial experiences, and how their mental well-being is doing, you could look at our first survey result. If you want to learn about how families spend time together, how they spend time outside the house, the meals they have, access to healthy food and reliability, and access to childcare, we have our second survey for that. And lastly, our third survey is about social support systems. So we just went over that, as well as information about their housing experiences and concerns, and experiences with employment as well. So if anyone's curious, please check out our website or reach out to me if you have any questions. Thank you so much.
Thank you so much, Arunima. And I know we still have some questions in the chat. We are working on those. Thank you for sharing those results of this really important research. And I definitely would encourage everybody to go to our website where the full results are posted, and reach out to us if you would like more information. So we're going to do a little bit of a switcheroo on our agenda. I know we think we had a little time for a break, but we actually have Ann Whalen, the Early Childhood Transition Director, here with us today. And I want to honor her time and everyone's time so that we have a chance to hear from her. And so we're going to go right into that, and then we could take a quick break before we go into the last section of our presentation today. I hope that works for everyone. If you need a drink, you need a snack, please go do that. And yeah, I'd love to turn it over to Ann.
Great. Thank you, Angela. I love how my introduction is, please step away and go take a snack and a break. No, I'm kidding.
I know snacks are important to you, so I just felt like I could say that in this space.
I keep snacks by my desk at all times, and I would encourage everybody to take a stretch break and take the personal bio break you need in this time. I'm available after the call if anybody has any follow-up. So as Angela mentioned, my name is Ann Whalen. I am the Early Childhood Transition Director with the state, helping to stand up the new state agency, the Department of Early Childhood. And it's such a joy to be here with you all today to share a little bit about the work and opportunities to engage in the transition process. Next slide, please. Next slide, please. So wanted to start by just anchoring in the why we are standing up a new agency. And this is building off of years of conversation across Illinois through the Early Learning Council, through other advisory committees and work groups, but was also one of the key recommendations that came out of the Early Childhood Funding Commission report in 2021, which really outlined that in order to continue building off of the progress for early childhood within the state of Illinois, one of the next steps should be looking at the governance and bringing everything together under one roof and creating one vision for early childhood in order to help this system be simpler, better, and fairer. And we're doing this to make it easier for parents, simpler for providers, and more cohesive and streamlined at a state level. Next slide, please. I'm sure many of you on the call has seen this slide or have experienced this slide, which is currently the early childhood programs and services and funding streams are spread across multiple state agencies, and it's often challenging to identify who do you call for what, or who's doing that rulemaking and which form is for what. And we know that there's some redundancy or duplication in our process and systems, and sometimes even more challenging that things are in conflict, that there is a set of rules here and a set of rules there, and they don't always work together. And the individuals at the state have been trying hard for many years to align this work and to get better and make progress, and they've done a tremendous amount in the last few years. And there's only so far you can go when things are in different agencies and have different leaders, and there isn't one cohesive vision for the state. So this is truly an historic moment where we're bringing everything together under one umbrella. Next slide, please. So as part of the commission report that I referenced in the earlier slide, there was a proposal to move the early childhood programs under a new single agency. And the programs being proposed to move are those in blue. And so from the Department of Human Services, that the Child Care Assistance Program, or CCAP, the Migrant and Seasonal Head Start, the Head Start Collaboration Office, and then the 3 home visiting programs administered by the Department of Human Services. In the State Board of Education, it is the Early Childhood Block Grant, and that includes the Preschool for All expansion, as well as prevention initiative. In the report, I'll pause here, just get a little wonky for a quick second. In the report, the commission proposed that the Early Childhood Special Education Program also move to the new agency. And in conversations with the federal government, it is in federal statute that the state educational agency, or in our case ISB, has to be the fiscal agent. So the program can't move to the new agency. And we know that one of our priorities is going to be, how do we improve the coordination of these services in early childhood? So I'll get to this in a few moments, but this is one of the first work groups we stood up, is thinking about how we can make this better for families and providers. And then finally, in the Department of Children and Family Services, it is moving the childcare or daycare licensing function to the new agency. Next slide, please. And I know many people on this call were part of the effort to get Senate Bill 1 passed. And I really want to thank everybody who lended their voices, who lended their emails, or he talked to somebody and supported this work. But we are excited to say that Senate Bill 1, which authorized the standing up of the Department of Early Childhood, passed out of the General Assembly this spring, and it was with in the state Senate unanimous support, and in the House bipartisan support. And so there was really overwhelming agreement that this was like one of the right next steps to take as a state to bring this together in the new agency. And the governor signed the bill into law on June 25th. So it's official, the department exists. So we're excited to share that. Next slide, please. And as we're thinking about this work, we are really breaking it out into multiple phases. So the first phase was the planning to launch phase, where we drafted the legislation, stood up the Transition Advisory Committee and a couple of engagement opportunities, and began planning for what it would look like to stand up a new agency. We are now entering phase 2, which is kind of the standing up, which is building the capacity of the new agency. So hiring on team members, mostly on the operations end, to help with the financing and the systems and structures, but then also taking this moment, which is truly a historic moment in time, to do some thoughtful thinking about what does it mean to align these programs and to co-design what they look like to support children and family across the state. And then the new agency will become fully operational and begin administering the programs and services that I just referenced on the previous slide, starting July 1, 2026. But in the meantime, between now and July 1, 2026, the legacy agencies, and that's ISB, DHS, and DCFS, will continue to administer these programs and lead the continuous improvement efforts that are underway. So again, I want to thank everybody on this call who's been part of all of those advisory groups and feedback sessions to help us think through how we can improve existing programs and services, as we are also envisioning and standing up the new state agency. Next slide, please. Great, thank you. We wanted to share a little bit about the simpler, fairer, better. As you saw earlier, like this is part of our goal of standing up a new agency, is to make it simpler, fair, and better for families and providers. And by simpler, we mean is achievable for all families and providers, and advancing efficiencies. And I want to be really clear here, by efficiencies, we don't mean cuts. We mean simplifications. We mean reducing burden. We mean making it easier for people to navigate the system and access the services they need. So examples of this includes a family and provider portal, or aligning funding streams, and aligning the reporting requirements. So that's what we mean when we say efficiencies. By fairer, it's achievable by advancing services and supports in an equitable way. And that's delivering services and supports in targeted ways to those that the state currently is not reaching or serving well. And that includes, for us, prioritizing families with children with special needs, as well as multilingual families in the system, because they have historically been some of our least well-served groups within early childhood. And again, fair does not always mean equal. We really want to make sure we're being equitable in how we're thinking about these services and supports. And better comes when improvements and efficiencies are identified through assessing and aligning the need and want with what services and support the state and state intermediaries are providing. So kind of matching the want and need with then delivering on those services. Next slide, please. So I want to pause and talk a little bit about what this will look like in practice as we're thinking through the innovation cycle. So first, we are committed to starting with families and identifying what they want and need out of the system. Next, we're going to work with providers to identify what they need to deliver those services to families. Next, we're then going to identify how to align state policies, operation, and grants to then support providers in delivering those services. Next, then we're going to work with the governor's office, the General Assembly, and through our budget and policies to execute against those recommendations. And then next, we will support implementation. And I want to kind of underscore here the continuous improvement lens, which is we know this is not going to be a one and done, that this is going to be a process, and we are committed to learning and continuing to improve in implementation and support. And part of that is going to be investing in building the state's muscle for those feedback loops, both qualitative and quantitative. And I think we've begun really building out those muscles in the last few years, and we're going to continue to do that. I also want to just underscore here that innovation doesn't always mean new ideas. We know that there have been a lot of wonderful pilots. There's a lot of amazing work happening in communities already, or ideas that have already come out of existing groups and coalitions. We really want to take this opportunity to harness this and figure out how we can scale innovations that are working for families and providers. Next slide, please. So to do this, we are also ensuring that there are multiple opportunities to engage and gather input from diverse perspectives. We want to make sure that there is no one place where we're trying to come up with all the solutions, or worse, if the state's trying to come up with all the answers themselves. So we are leveraging existing tables and starting up new opportunities to hear from families and providers and other stakeholders within the group. And I know, again, many of you on this call have been part of some of our regional listening sessions or have participated in some of the surveys. So appreciate your support in engaging in those. And there are going to be more opportunities to come, but just wanted to thank you for your insights and lived experience and priorities that you've already shared with us. Next slide, please. To help us do this work, the governor has appointed a Transition Advisory Committee, or TAC, which is made up of individuals from across the state. There are about 20 of them who represent different roles within the ecosystem and different perspectives within the state. And the TAC, one of the main charges of the TAC is to help the state make meaning of stakeholder input, with a particular emphasis on understanding families' goals and needs and what we need to do to work with providers to deliver against those. The TAC has been meeting since last December, and it meets monthly, and those meetings are public, but they are helping making sure that we are centering family voice, centering equity, not just in outcomes and outputs, but throughout the process of the transition. So just want to thank those individuals who have been part of that work and helped us get smarter and better as we continue to move. Next slide, please. In addition to the TAC, we have also stood up and are in the process of standing up additional work groups to help us think through specific areas or topics that we know from the listening sessions and from previous reports and recommendations that there are areas of opportunity and improvement. And those include what we're calling family service work groups. So those are focused on supporting families with children with special needs, supporting multilingual learners and their families, and the workforce. And we are starting with those. We want to make sure that, as you see from the slide, that the tail doesn't wag the dog, that we're not saying, this is what the state can do, and therefore this is what families want to need. Instead, we really want to make sure we're starting with families and providers to then create the foundation in which we're thinking through the rest of the recommendations. So in these family service work groups, the largest stakeholder group is going to be families and parents. The second largest stakeholder group is providers. So just want to underscore that. And they are really going to be charged with helping us articulate, design, and redesign supports for this work. There will then be additional work groups around that we're calling the support work groups that are going to focus on some of the enablers we know that will help our system be able to deliver on that work. So that includes data analytics and insights, funding alignment, intermediary alignment, standards alignment, social emotional supports, advisory bodies and governance. And this is where I'll pause and say, like, these are the ones we're standing up now, but if there are areas we're missing, or as we learn more and we figure out we need more work groups or sub work groups, like, we are willing to help stand those up and welcome any feedback on this call if we're missing anything. But these work groups are really helping us think through the systems and services for what it will take with the new agency and with this new vision, and start really building out the enablers for the work. The work groups that are in red have already launched, but we are adding additional participants to them. There is a open interest form if people would be willing and able to engage in these conversations at a work group level. We would appreciate if you express interest through the interest form. But in addition, we know not everybody in the state can sit on a work group, so we are also going to have what we're calling focus discussions, where a work group may come up with an idea, and we then will want to have a focus discussion with parents of children who are birthed through 3 and say, what does that look like and feel like to you? What are we missing here? Or may want to have a focus discussion with providers in rural communities, or with home visitors, or with EI providers, to make sure that we are thinking about the multiple lenses of this work, and it's not just one individual or 2 or 3 individuals representing the totality of work within the state. So we have the work group, that we're also very committed to creating additional opportunities for people to provide that feedback, help us identify what we're missing, help us identify some of the unintended consequences of the ideas as we move through this work. Next slide, please. I'm not going to read this because I know we're relatively short on time, and I want to make sure we leave a lot of time for Q&A, but I just want to share, we're getting like a huge breadth and depth from our engagement thus far about both how we can improve our process and some of the challenges that are existing today. And we are truly using that information to guide our work and inform our priorities. So I would encourage you to be providing us feedback, providing us questions, providing us priorities, and then also share with your networks, because we do want to make sure, again, that we are really having a strong cross-section and the diversity of the state of Illinois who are impacted by the early childhood system. Next slide, please. On our website, and that's our link down there, there are a lot of resources, including the materials that have been developed to date, some information about engaging in additional opportunities like the listening sessions or the TAC meetings or the survey links. We also have all of our meeting material summaries online. We know that our website is a work in progress, and we are trying our best to improve and help people navigate a little bit better, but we are trying very hard to make everything public and online. And I apologize, I should have mentioned that all the work group meetings and all the TAC meetings are public meetings. Anybody can attend, and we are trying to make ways for people to engage in that, both through Padlet forms, through the chat, and then in the work group meetings, there will be kind of a traditional public comment section if people have areas they want to discuss with the work group. Next slide, please. I see this was a request in the chat. I anticipated it, but here is my direct email. People should feel free to email me with additional questions or follow up or priorities. Welcome that at any point in time, either today or anytime moving forward. Oh, Michael, thank you so much for putting the interest forms in the chat. I appreciate you. Okay. Let me pause and see if there are questions.
And there were a few in the chat. I can read those to you if that's helpful? Yeah. Of course, now I have to scroll, which is always a challenge. Here we go. So I think the first one was from Missy Brown. And she asked, where will the core side of CCR&Rs live in the new agency? And I think, and Missy and others, correct me if I'm wrong, I think core refers to some of the other functions beyond CCAP, such as training, quality improvement, consultation in the CCR&R system.
That's a great question. All of that will move to the new agency. So all of the contracts and the TA and supports that are supporting these programs will also transition to the new agency. And like, this is also where I would add, like, these are then opportunities to think about integration, improvement, redesign as well as part of this process. And I think you saw maybe some of that in some of the work groups where we were thinking about intermediaries, and thinking about like how do we assess where we have some gaps in services specifically, maybe potentially, and like how, like what we can do as a state and what is needed to be responsive to that.
Thank you. Okay, the next question. During the current transition, INCRA and DCFS are almost unavailable and appear to have very little answers to our needs. Any ideas or suggestions how to handle? I don't know if that's a question for you or for us. And I know I can say I've seen some things posted online about some tech challenges and things happening over at INCRA. So I don't know if you can speak to any of that, Anne, or not.
I don't know, but if there are specifics that I can help with, I will do my best to try to help. But I wasn't aware that there were challenges, so that's also very helpful to know.
Yeah. Thanks for that question. I think if there's some specifics, feel free to send those to us and to Anne as well, and we will see what we can find out. Okay. I think the third question I see is around from Melinda. Others have asked me how they are reaching those who aren't digital for their opinions to make this equitable. I thought it was a great question. And I know we spoke about the listening sessions and some of those other opportunities, but is there anything you might want to add around that piece of digital engagement?
Non-digital engagement, sorry, I couldn't hear you.
Oh, sorry. Yeah, around reaching those, a lot of the opportunities are online surveys and forums, and we know the listening sessions, some of those have been in person. So I know that's one opportunity for folks to engage, but are there other opportunities or things you might want to say in response to that?
Well, first, let me just do another sentence or two about the regional listening sessions, because I didn't go into a ton of detail about that. So the state has been holding bi-monthly listening sessions on Fridays, and I'm happy to share those next scheduled dates with everybody on the calendar invite, where anybody can join, learn about updates with the transition, ask questions, share priorities. We will often have very specific questions that we have for the group who shows up to help us get smarter and better understand the landscape. Like we had a bunch of questions about data, a bunch of questions about multilingual learners and their families that will then come back again in a different form as we're innovating. We heard from many stakeholders, including some of the stakeholders on the call, that it would be really helpful to then provide opportunities for regional conversations across the state and in places and spaces where maybe the state doesn't always go. So we really appreciated that. And starting in July, partners, including Action for Children, and I see many other people on the call who helped with this, but led or co-led regional listening sessions where we had a toolkit and people could adapt, but could share kind of updates on the transition, why we were doing the transition, but just as importantly about half the meeting or conversation was spent getting feedback from people about kind of what's working well and their priorities for this next phase of what early childhood can look like within the state. We left it up to those who were helping lead or co-lead the sessions, like the format in which they were available, but we do know that some of them were in person and had a lot of very rich table discussions. I actually was able to join one of the ones that were in person. It was wonderful. But that's an example of what we are trying to do. We're also hearing from people that having some like printouts and flyers might be really helpful for people to share updates of what's going on. But if anybody on this call has specific suggestions about how we can be doing this better, we welcome that. I think we, again, are really trying to learn about like what works in different parts of the state and in different settings, and trying to be responsive to that. I will say we're not always able to flip a switch and be responsive the next day, but I do hope you see that we're kind of learning and growing throughout this process.
Thanks, Anne. I think we're going to try to wrap this up at 12:55. So can we have you for 3 more minutes for a few more questions?
Of course.
Okay. question around the timeline for hiring a new head or director for the new Department of Early Childhood. Anything on that?
Great question. So we have a secretary of the Department of Early Childhood that was in the statute. There has been a national search for that permanent secretary that has been led by Koya Partners over the summer. Interviews have been happening this fall, and I am told that we will have additional updates very soon. I don't have a specific date, but I'm hoping that it will be within the next few weeks. And that will just be more of an update as we've selected someone, but they may not be able to start until the new calendar year. I think it really depends on their circumstance. But hopefully we'll learn more very soon. We're excited about that. I should also add, in the interim, we do have a acting secretary, Secretary Irma Martinez Snopek, who has been amazing and has been supporting this work, as she has also been in her role at ISB as the Chief Policy and Communications Officer as well.
Thank you for that. I think we have time for one more question. There's sort of two together that I'm going to go through, and it's really around the work group process. So if you've applied for a work group, when can you expect to hear anything about that? And can you share a little bit more about the selection process and how people are selected?
Sure. So the interest form, we tried to make it easier. And again, I think we're learning. And so we had multiple areas or work groups you could express your interest for in one form. But that also means that the interest form is going to stay open as we launch some of the early work groups. We're going to keep it open for some of the ones that we'll launch later. So again, I think we're going to learn how that works for people and whether how we can improve on that moving forward. We do plan on, as I mentioned, adding additional participants to the 3 that are existing and launching the funding design work group next. And that should happen in the next kind of week or two. The following one will be the workforce work group. And then the intermediary work group will be following off of that. The timelines for those are a little dependent on procurement, I'm sorry to say, so I can't give you a specific date, but we're hoping to launch them all before the calendar year. So when individuals will receive notification about specific work groups really depends on which work group they express interest in and whether they selected for that specific work group. I will just say again that the work groups are kind of one avenue for engagement. We will be leveraging and really relying on a lot of your expertise through focused discussions as we are doing this work. So I hope that those who expressed interest in work groups, if they're not selected, they will be willing and able to participate in these focused discussions as we continue to kind of get feedback and help ask for people's lived experience and expertise in shaping this work.
Thank you so much, Anne. Really, really appreciate you being here. And I think your email is now in the chat. So folks know where to reach you. And of course, we will also share any other feedback we get from this conversation today. So thank you so much. I think I am kicking it to Michael.
Can I just say just a huge thank you to Action and to specifically Angela and Michael for creating the opportunity for this conversation today. Really appreciate it. And thank you all for your questions. Keep them coming. I do really appreciate the feedback. So thank you so much.
We appreciate you, and thanks so much for jumping on. So everyone, like I said, it's gonna be 2 hours of your two best hours of your day today. So we are gonna keep going. But while we do that, we're gonna take about a 3-minute break so that we can get the breakout room situated and everyone into one. So if you guys need to go into do some bathroom break or whatnot, this is the time to do it. We'll be back in 1 o'clock and have everyone come into breakout rooms, and we will share what we were going to do for breakout room and who's going to go into which ones. All right, so stay tuned. All right, hope you guys had a nice little break. So as promised, we're gonna break off into some breakout rooms so that we can discuss a little bit more about what we want to see, vision for the new agency and some of the other priorities that you guys might have of interest. So as the screen says, you'll receive an automatic message to join a breakout room. So when that happens, please click the join button so that you can get into one. When the breakout rooms are over, you'll automatically be sent back into the main room. If you have any questions getting into a breakout room, just directly message Aman and he will help you out, and we can go from there. So next slide, we are going to talk about some of the questions that we want to address in our breakout rooms. So we have 3 very good questions that we can hopefully use in the next this coming session and moving forward. First one is what is one easy change or quick win you like to see by or on day 1 when the new Department of Early Childhood begins operating their programs. The second one is when you attend Fall into Action in 2027. We hope to see you guys in 3 years, so be prepared for that. The Department of Early Childhood will be operating for about a year at that point. What major policy change do you hope we can be working on during that time? And then the last one is, what else is on your mind this coming legislative session? Do you guys have any specific policies or anything that you guys are wanting to see change? So if anything of that is on your mind, just shout it out in your breakout room, and we will take those into write them down in our notes. So let's all go to our breakout rooms, and I think each facilitator will read out the questions again, and we'll have about 15 minutes to talk, and then we'll come back, do a quick share out, and then close out the webinar.
And just a very quick note before we open the rooms. If you are a Spanish speaker, do not join your room, stay in the main room so that we can do interpretation. So if you are a Spanish speaker, please stay in the main room. All right, thanks. Go ahead, Aman.
Thank you, Bree. Conversation. Let me start that over. I hope everyone had a good breakout session and had very productive, good conversations with everyone. I know the one I was in was really happening, so it was fun to just hear a lot of stuff with the folks that are in our group. I'm gonna provide like 3 minutes if people want to just share out any interesting things that they talked about in your breakout rooms. If there isn't any, we can just move over to our last portion of the webinar and get you guys out of here. But I just want to give 3 minutes to folks to just come off mute and just say quickly what you guys talked about, if you guys want to share.
Happy to jump right in. We had a pretty robust conversation. It was so good. We didn't get to the last question, but we did get to a bunch. And so First question, an easy change or quick win we'd like to see by day one when the new Department of Early Childhood's operating, streamlining the fingerprinting process, streamlining CCAP billing, reimbursement, making sure that families have easier access to programs and whatever they need to access care. Reduction of turnaround time, some metrics and updates for parents as they're making their way through the process, also streamlining the process. Also, like a trigger program system, which I think is a kind of amazing idea, is if you qualify for one thing, you should automatically be notified of what else you qualify for. And one application that would apply to all of these processes. For the second question, we heard state and federal need to be working hand in hand. There needs to be better coordination. We also heard with ECSC, with special ed kids, IEP kids, there's different rules for different kids, and the checklist should be streamlined. The criteria should be streamlined for both, for different groups of children, so that being able to meet needs, is kind of more straightforward and then better streamlined process. In addition, we also talked about funding for early intervention. So making sure that parents are aware of options, transition, support from early intervention to therapy needs to be streamlined. The transition needs to be smoother. There's still wait lists. There's all of these problems which cause parents to drop off. So the transition needs to be better and more streamlined. That's a quick overview of, I've got more, but I'd like to give space for other people to speak. So that's what we had with our group, and it was a good discussion.
Thanks, Naima. Yes, I'll give 1 more minute since we are at 1:25, but I will give 1 minute if anyone is dying to share out. I don't want to take away anyone's wish to speak out, so I will stop talking.
I'm going to jump in real quick. We just talked about organizing this new system around the regions that would be more vertically aligned instead of having EI and DCFS over multiple counties and regions, where school districts or local providers need to engage with multiple other agencies, streamline it. So Birth to 5 is arranged around 39 regions throughout the state. Public schools are same, 39 regions. Make it simple, make those agencies fall into that structure so that as providers in all of the various ECEC sectors, we get to know each other, get to know our community and our needs in our region. And then from there, making sure that you have representation in the follow-up for the evaluation process. How's it going? You have voices from the field in those areas to then, act on what's best for the needs of that region.
Thank you. All right, so we are gonna take the last 4 minutes to wrap up. I'm gonna pass over to Naima real quick to talk about some of the things that are happening with We the Village.
Thanks so much, Michael. Just quickly, We the Village is a coalition, a diverse coalition of parents, organizers, caregivers, activists, folks that are working in the field in various capacities as providers, families, nonprofit organizations. We're fighting for adequate and sustainable and reliable funding for children's services. We want to ensure that the workforce is adequately compensated and that providers and educators have what they need to provide high quality care. We want to ensure advocacy efforts are geared towards building a sustainable workforce that provides fair pay and benefits. We want to ensure that children can access quality education and care based on parent choice or family choice. And we want resources to be invested in children and communities that need it. We want to eliminate racial, socioeconomic, and other disparities. Next slide, please. Next slide. Thank you. We focus on workforce. We're focusing on robust provider pay, benefits, education, training. This includes advocacy around Smart Start, ECAs, a lot of the things that we mentioned on this call. We're also working on state investment. This includes advocacy around the fiscal year FY26, which we're about to enter, budget. And so, sorry, when I mean about to enter, I mean we're about to enter advocacy around the upcoming FY26 budget. And so we're demanding robust support for the early childhood education care programming and for the communities in Illinois that need the most. We are also working to further the development and streamlined, effective regional local community systems that meet the needs of providers. We're interested in transparency and equity as well. So this is going to look like monitoring and evaluation of the new agency as it comes together, advocacy around various components of the new agency as it comes together, and ensuring all voices that need to be at the table are being heard. And so to that end, I am going to ask folks if we can go to the next slide. If they're interested in learning more, to reach out to me. I am dropping some information in the chat here. Sign up for the coalition, learn more about our actions and advocacy work that's upcoming, get trained around advocacy, get trained around issues that are relevant to you and your community, and meet with and educate your officials about early childhood and the importance of fully funding and the importance of ensuring families have what they need. That's it. I'm going to pass it back over to, I think, Michael or Bree.
Thank you so much for being with us today. I hope this was the best 2 hours of your day, as Michael promised. Just as we close out, a couple of action items for you all, because this all only works if we're all working together. So register to vote if you haven't already. Get out there and vote. It's so important. Childcare, early education is definitely on the ballot, as Michael showed. And so do please make your voice heard on Tuesday, November 5th or early. Naoma just gave a great spiel about the We the Village Coalition. So if that is of interest to you and you want to collaborate with a big group of advocates, please do join us there. If you're a childcare provider and you are interested in kind of a provider's only space to focus on some issues that are relevant to that group, things like licensing, things like learning standards, Providers in Action is a great group to join. We do a lot of work like that. We meet every other Wednesday. I will put my email in the chat if you are interested in learning more about that work. And then lastly, if nothing else, definitely stay involved. Sign up for our eAdvocate newsletter, sign up for the We the Village newsletter, because throughout the year we'll have lots of opportunities for you to get engaged, stay involved, and take action. As you can see, there's a whole lot going on. So thank you so much, everyone, for being with us today. Please have a great rest of your day and a great weekend.
Hi, everyone. Thank you so much.
Thanks,
Have a great
everyone.
day. See you soon.